Okay, we're at 12:15.
Sure. Thank you all for taking your lunch hour to join us for today's webinar. My name is Wagata Semre. I am an associate professor of medicine and practicing primary care provider at UCSF, and I direct the Champion Provider Fellowship. We're very excited today to have Dr. Kearns here presenting. She's been a longtime supporter of Champions and a true thought and policy leader when it comes to sugar and oral health messaging. So with that, why don't we start with our land acknowledgement. We would like to acknowledge the Ramaytush Ohlone people who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place, the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding.
Thank you, Agata. Some housekeeping. We'll keep everyone on mute. To better view the webinar, keep your Zoom on full screen to see our PowerPoint. We will track our questions and comments in the chat box. So go ahead and type in questions that you may have in the chat box. We'll take Q&A at the end. Recording of this webinar and the PowerPoint slides will be available on our website by next week. If you have any TA requests, you can message me in the chat box. Now, moving on to our upcoming events, we have our February Works in Progress call for the fellows on February 8th. We also have an LHD call on February 15th for our LHDs. We also have our Persuasive Narrative Series training for our fellows on April 16th. So that is open to our current cohort as well as our alumni. We have limited seating for our alumni. So look out for our registration link when that opens. We have our mini college in San Diego on May 22nd. That registration link has been sent out to our current cohort as well as our LHDs. You can also find our information about our events on our website at the link at the bottom of this PowerPoint slide. And then at this time, I'm going to turn it over to Dr. Phaedra White, who is going to introduce today's speaker. Dr. White is a Champion Provider Fellow alumni, mentor, and the Chief Dental Director for the County of San Diego.
Hi, thank you, Nancy. I'm excited to be back with everyone in this group. I am pleased to introduce today's presenter. Dr. Kearns is an associate professor at the University of California, San Francisco School of Dentistry, and the Philip R. Lee Institute for Health Policy Studies. She is one of the first academics to rigorously study the influence of the sugar industry on health. She first saw the devastating effects of sugar as a dental director for clinics serving low-income populations, and then as a manager of the dental operations at Kaiser Permanente Dental Care Program. She has helped identify 600,000 pages of food industry-related documents now available online to researchers and the public in the UCSF Library Food Industry Documents Archive. Following Dr. Kearns' presentation, we will allow time for discussion and Q&A, and you can just put your questions in the chat box. So I'm going to turn it over to Dr. Kearns now.
Great. Thank you so much, Phaedra, and to Wagata and Nancy for the invitation. Always love to present to this group. Let me just take a second here and get my screen shared and set. Can everybody see that okay?
Yes.
Yes. Okay, great. Okay, so yeah, the title of my talk, Sugar and Oral Health Messaging, Implications for Policy Systems and Environmental Change. And I usually like to start off just giving you a little bit on my personal background and how I got interested in studying this. And so it started for me when I was working at Kaiser. So I was no longer practicing clinically. I was managing operations for Kaiser Permanente Dental Care Program in the Northwest. And I was attending a conference looking at the links between periodontal disease and diabetes in 2007. And I was given this brochure put out by the CDC and the National Diabetes Education Program designed for dentists and giving some instruction on how to talk to type 2 diabetic patients showing up in your practice. And I flipped open to the diet advice in this brochure and saw this. It said increasing fiber and limiting saturated fats and salt will help control blood glucose, blood pressure, and cholesterol. But I noticed a glaring omission here, which there was absolutely no mention of reducing sugar consumption to manage type 2 diabetes. And I was shocked. I got another handout at this conference. It was this fast food guide to nutrition given by one of the keynote speakers. And I happened to flip open to the page on drinks and noticed that Lipton Brisk sweet tea with 44 grams of sugar was given a green light as a healthy drink. And this really got to me. And so I actually jumped up to go approach the speaker who was trying to leave and go catch his flight, and actually chased him down and asked him, how can you rank this as a healthy drink? And his response to me was, there is no evidence linking sugar to chronic disease. And I was literally speechless because we're at a dental conference, sugar, dental caries is the #1 chronic disease in children. And he just turned around and walked out the door. And I left that conference kind of a different person. I wanted to understand what was going on. Why is it that these brochures and this guidebook were saying this about sugar? I just couldn't reconcile it. So I needed to know more. And while still working at Kaiser, I kind of on the side, I started investigating the sugar industry, wanting to know somehow had the sugar industry maybe impacted what I was hearing related to diabetes policy. So this is a screenshot from back in 2007 when I was doing my little investigative work from the website of the Sugar Association. And the Sugar Association represents cane and beet sugar producers in the US, particularly around sugar and health issues. And so here they were boasting that sugar had been the subject of scientific scrutiny. Over 1,000 scientific papers had dispelled the links between sugar and diabetes, hypertension, behavior problems, and obesity. And then they listed government reports that had supposedly exonerated sugar from being linked to chronic disease, including the FDA and the National Academy of Sciences. And again, I was just shocked, and I couldn't believe what I was reading. How can this possibly be true? So I didn't stop there. I kept digging and somehow happened upon some confidential sugar industry documents in a local library from the Great Western Sugar Company. So the Great Western Sugar Company was based in Denver, Colorado. Colorado is a big state for growing sugar beets and refining sugar. And they went out of business in the 70s when high fructose corn syrup was gaining market share. And they donated much of their company records to like Colorado State University and other libraries. And it had been screened by lawyers, their records. So some of it was excluded, but there were a few boxes related to nutrition policy that I noticed. And I happened to go up and take a look at them at Colorado State. And the first folder that I opened had a confidential memo from the Sugar Association right there for me to see. And I, again, just kind of shocked that I would come across this material. But this led basically to a whole new shift in my career, like wanting to understand the sugar industry and how I could research this work and make it relevant to policy. So it's a long road, but ultimately I ended up at UCSF working with the Center for Tobacco Control Research and Education, where modeled after the Tobacco Industry Documents Archive, we've now launched the Food Industry Documents Archive. And so this is the web page for the Food Industry Documents Archive. And we've got over 20 collections, about 3/4 of those I've personally identified and screened through and helped the library acquire. And we launched this in 2018. So if you type in the search term dental caries, you get over 2,700 documents back. And so the sugar industry has a lot of interest in dental caries as an issue. So I wanted to give you kind of an overview of the sugar industry's view of us as dentists from the work that I've done and the documents that I've collected. going all the way back to the 1940s, which is when one of their big trade groups was formed called the Sugar Research Foundation. And the Sugar Research Foundation was very concerned with anti-sugar dental beliefs out there in the world in the 1940s. And this was the time period of World War II. And sugar was being rationed by the federal government. So civilians couldn't access as much sugar as before the war. And nutritionists were saying, you know what, this rationing program is a great thing. It's reducing sugar consumption. This is really good for health. When the war is over, we should keep sugar consumption levels down to the levels of rationing. And the sugar industry was terrified of this happening. And so they were looking everywhere for people who had these anti-sugar dental beliefs. And some of those beliefs were that Americans were eating too much sugar, particular to dentistry, that the overconsumption of sugar causes caries, and that sugar causes teeth to decay more than any other foods. And the sugar industry saw these nutritionists as spreading some of these anti-sugar dental beliefs to dentists. And they were concerned. They were characterizing these anti-sugar dental beliefs as a virus, as an infection, and that dentists were being infected with these anti-sugar dental beliefs. And they wanted to understand to what extent had dentists' minds been poisoned by these anti-sugar dental beliefs, because they were worried that dentists would organize and work towards policy to reduce sugar consumption, or they might advise their patients in their chair to reduce sugar consumption. So ultimately, the sugar industry and other members of the food industry have, as I would describe it, been engaged in a war on anti-sugar dental beliefs for, I would say, more than 100 years. And they break down kind of the enemies in this war as individual dentists, academics, particular organizations like the American Dental Association, or some of our research organizations like the International Association of Dental Research. They're also constantly monitoring the news media or the scientific literature for any publication that might paint sugar in a negative light so that they can counter or respond to it. They're also paying very close attention to policymaking with anything related to sugar and dental caries. So looking in the documents, there's some pretty clear statements about the sugar industry's position on sugar and dental caries and what they've been up to. And one of those things is related to dental research. So the sugar industry has actually funded quite a bit of dental research, where the ultimate aim of the foundation in dental research has been to discover effective means of controlling tooth decay by methods other than restricting carbohydrate intake. So anything but reduce or changing diet is what the sugar industry was interested in. So for example, one of our papers looked at the research program in the 1960s and 1970s, where the sugar industry actually collaborated with the chocolate and confectionery industries. Just the sugar industry spent about $85,000 on this project, which is actually only 4% of the overall budget when you consider all the partners. And the types of things that we're looking at were dextranase enzymes. So the idea was this enzyme could be added maybe to toothpaste or to foods that would break up the plaque in your mouth so that you could eat sugar with impunity, as long as you had this dextranase enzyme to break up the plaque, and also trying to develop a vaccine for dental caries. Neither of these were really all that feasible. However, the sugar industry, we were able to show, actually influenced research agendas at our National Institutes of Health and the Dental Institute. And some of these initiatives were adopted and supported early on based on some sugar industry influence at the NIH. In some more recent work, my colleague and I, Richard Watt, we argue that dental caries prevention needs to be understood not just as a health issue, but as a contested political issue that's influenced by powerful vested interests. And to demonstrate this, we used a public policy framework. Second here. So in policy analysis, the process of characterizing problems is known as problem definition. And opposing sides in a contested policy situation can gain advantage through problem definition using forms of public rhetoric. And these categories were identified by Rochford and Cobb in this book that I have here on the slide. They identified recurrent categories of problem definition claims. So we're going to go through all 7 of these. I'm not going to explain them right here. And so we examined contested claims related to dental caries in the context of the World Health Organization. So this slide is a boxing ring. And the context, the venue is the World Health Organization. And in each corner are the contestants. So on one side, we have the expanders who are trying to frame the issue of dental caries in a way that makes policy action on sugar likely, while the containers are seeking to contain the policy issue to not include policy action on sugar. And at the World Health Organization, dental caries has been a contested critical issue that's been on their formal agenda for nearly 40 years. So we actually had a lot of material to look at in these expert reviews. So the expanders in this case are really represented primarily by Aubrey Shyam, who was big in dental public health, who's just passed away within the last 5 years, who was at University College London, often on many of the expert committees for WHO. And he's played a central role in keeping the evidence on sugar and dental caries before policymakers. And these are a couple of his key publications. On the container side, we have representatives of the sugar industry. So one organization is the World Sugar Research Organization, also based in London, represents countries all over the world, including Coca-Cola, and a group called the International Life Sciences Institute, also some candy companies like Mars and other global sugar companies. And then back to our boxing ring here. Now I've got the championship banners hanging from the rafters to indicate the boxing contests that have happened over these last 40 years related to sugar and dental caries. So over the last 40 years, 5 different expert committees have evaluated the role of sugars in dental caries, and they've come to different conclusions. So the first one there in 1979, they acknowledged cariogenicity is a word that just means foods that cause tooth decay, foods that cause dental caries. So in 1979, this expert committee acknowledged the cariogenicity of sugars, but they didn't make any specific recommendations on sugar restrictions. Then in 1990, the expert committee actually endorsed a 10% limit on added sugars. And so this was a win for public health. 1997, that 10% limit was reversed. And this expert committee found that there was no evidence of direct involvement of sugar in the cause of dental caries. And so that was a win for the containers and the sugar industry. And indeed, a subsequent investigation by the BBC found that the sugar industry donated $60,000 to the WHO during this expert committee consultation, and they were able to influence the nomination of experts that took part in that expert review. And some of the committee members felt pressured not to say anything bad about sugar during that expert review process. 2003, expander side won out again. They were able to get this 10% limit endorsed. However, in 2004, when this recommendation was being considered for the final policy document, United States, through influence in the sugar industry, threatened to pull funding from the WHO if they included that 10% limit on added sugars in the final policy document. And it was reversed. So it was a win for the sugar industry, the containers. And then finally, in 2014, that 10% limit was endorsed again in the WHO's guideline on sugars intake for adults and children, finally endorsed and put into policy in 2015. So it was this 40 years of back and forth, these contests between public health and the sugar industry, resulting in the delay of the WHO adopting policy on added sugars and dental caries for a long time. So we looked at the claims-making activities that were going on the expander side versus the container side, using that public policy framework starting off with the incidence or prevalence of dental caries or tooth decay. So asking the question, how many people have been affected by dental caries? On the container side, the industry argues that there have been enormous improvements in dental caries rates, and they cite studies looking at the decreasing prevalence of tooth decay in 12-year-olds in Western European countries, not disclosing that those are industry-funded studies. So they cite industry-funded studies to support their arguments. On the expander side, dental public health argues that the conquest of caries has been greatly exaggerated. And while there have been improvements in dental caries, problems still persist. Tooth decay is not just a disease of childhood. We need to look at tooth decay from a life course perspective, and that tooth decay occurs at a relatively constant rate across the lifespan, and that preventive measures are necessary at all stages. And related to causality, looking at the question, what causes dental caries? On the industry or container side, the industry argues that caries is a multifactorial infectious disease. This allows the industry to point to other causative factors, such as susceptible tooth surfaces, the frequency of eating, the intrinsic properties of the food, oral hygiene practices, fluoride availability, or genetic factors, or salivary flow. Whereas on the expander side, the public health experts argue that dental caries is a diet-mediated, non-communicable chronic disease. They argue that free sugars are the necessary cause of dental caries, and that this multifactorial framing muddies our understanding and misdirects policy away from national sugar restrictions. And then the third category related to severity, what is the impact of tooth decay on individuals? Is the problem getting worse? The industry is silent on this category, but on the expander side, dental public health experts argue that dental caries is the most prevalent condition globally, and that untreated caries and permanent teeth, again, most prevalent condition, causes pain, anxiety, functional limitation, and social handicap through tooth loss. And then looking at the fourth category related to framing the problem as a crisis, what is the urgency of preventing dental caries? Both sides use the language of cost crisis to make their claims. So the expanders use the cost of dental caries as a reason to act. Dental caries treatment consumes 5 to 10% of healthcare budgets in high-income countries, and that exceeds the entire healthcare budget for children in most lower-income countries. Whereas containers argue that cost is a reason not to act. So they claim, and this is a direct quote from the World Sugar Research Organization, that given that national governments worldwide are stretched to meet the healthcare needs of their population, it seems important to provide guidance in which there is considerable confidence to avoid wasting valuable resources on implementing actions that will not result in effective outcomes. And then the fifth category related to values. Both sides link their claims and their positions to strong emotional attachment, emotional related values. So the containers frame their claims related to personal responsibility. They emphasize individualism and that solutions to dental caries should focus on personal and behavioral factors influencing the development of dental caries. They also argue that singling out sugars from other causes or other carbohydrates is discriminatory. On the container side, public health experts argue that dental caries is related to quality of life ideals and human rights. We have a right to affordable dental care. And then the sixth category related to the characteristics of the problem population. On the container side, the industry argues that caries is decreasing and limited to only a small portion of the population. They also argue that reducing sugars intake for the whole population would only benefit a minority with high caries prevalence. whereas the expanders argue that most dental caries occurs actually in the majority, and that caries-free dentition at any one point is not a good predictor of zero caries incidence thereafter. And then finally, the last category related to solutions and specific to policy action on sugar. So here, the containers argue that policy action on sugar is expensive and ineffective. They argue that it would even be damaging to the public, saying that sugar would likely be replaced with unhealthy fats. They argue that efforts to prevent dental caries should focus on achieving adequate oral hygiene practices with fluoride toothpaste, and that that's what's been proven to provide a greater reduction in caries experience. And they also argue that dietary advice should focus on limiting the frequency of exposure, not the amount of sugar consumption. In contrast, the expanders argue that policy action on sugar is necessary, effective, and results in cost savings. They argue that dental caries will not be resolved without drastic national reductions in sugar's intake. They argue that caries still progresses in populations exposed to fluoride, that there are no known adverse effects of reducing sugar consumption, and that implementing sugar restrictions are likely to be associated with long-term cost savings in healthcare in countries. So some of our conclusions from this work looking at the expander and container claims made in these expert committee reviews at the WHO is that the industry, in this case, the World Sugar Research Organization and the International Life Sciences Institute, have sought to contain the dental caries issue over the last 40 years. They've done this by debating statistics, sponsoring conflicting studies, influencing committees, and tying their position to crucial societal values. And ultimately, they've delayed policy action on sugar. And things that we need to be aware of and thinking about resolving dental caries and solutions to dental caries is that these containers, these industry claims makers, will continue to advance their arguments as countries or states or local venues continue to decide whether or not to adopt policies related to sugar. These organizations, sugar industry organizations, they are connected by global networks. They're funded by transnational corporations with significant resources. And public health advocates, we need to understand and recognize these problem definition claims that are being made by these powerful vested interests, and we need to be prepared to counter them. So one of the things I continue to be interested in is whether or not we in the dental profession are using container language to talk about solutions to dental caries or expander language. One example of the use of container language can actually be found in the current statement on diet and nutrition from the American Dental Association. And in fact, the American Beverage Association cited the American Dental Association's position statement to undermine policy proposals in the city of San Francisco. And so San Francisco had proposed adding warning labels to billboards like the one pictured here for Coca-Cola. It would have said, drinking beverages with added sugars contributes to obesity, diabetes, and tooth decay. This is a message from the city and county of California. But the Beverage Association was able to point to dentist language, which said the growing popularity of singling out sugar-sweetened beverages. They caution against the growing popularity of singling out sugar-sweetened beverages because the evidence is not yet sufficient to single out any one food or beverage product as a key driver of dental caries. So this is an example of container language that the American Dental Association adopted. I am happy to report that they are actually in the process of updating their policy statement, which is going to contain much more expander language and be much more in support of policy action on sugar. but I think this is a really good example of how that container language can be detrimental to public health efforts and policy action. Okay, moving to some calls to action. So sugary beverage taxes are a major example of policy action that can be taken to reduce sugar consumption with a number of beneficial health effects, but of course, dental caries being one of them. And this paper on the left, advocating for soda taxes, how oral health professionals fit in. This was an analysis done back in 2016 by the Berkeley Media Studies Group, who looked at news articles related to the soda tax initiatives that were being proposed, voted on, debated in cities around the Bay Area in 2015. And they noticed that oral health professionals rarely appeared in those news stories. And tooth decay as a health effect of soda consumption was also often left out. And so they were arguing that we as dentists needed to elevate our expert voices, that oral health practitioners can contribute to new and salient arguments for soda taxes in the public discourse and can help advance public policy to improve oral health outcomes. And so we happen to have a new slate of soda tax initiatives coming up in 2024 for a vote. So we do have existing soda taxes already implemented in Berkeley, Oakland, and San Francisco, but they have sunset provisions built in so that they will be sunsetting. I think the years are slightly different for each one unless they're renewed. So these three cities, Berkeley, Oakland, and San Francisco, will be pushing for a renewal of soda taxes on the November 2024 ballot. There are some new proposals that are in the works. So we've heard that Santa Cruz is officially going to be pushing forward a soda tax initiative, and Redwood City is considering it. And I should mention that you might be aware that there is an issue with preemption in California related to sugary beverage taxes. And so this was a political, strategic, backdoor dealing example with the American Beverage Association, who, when there was a proposal to implement a state-level sugary beverage tax, this is sort of a long story, but essentially they were able to politically maneuver to get the state to agree to basically place a moratorium on any new soda tax in California for 10 years. It turns out there's a loophole in that preemption clause related to charter cities in California. And again, there's more detail, and I'm not familiar with all the exact detail, but charter cities have actually sued to be able to push forward soda taxes in their charter cities. So these two charter cities, Santa Cruz and Redwood City, are able to get around this preemption ban and push for sugary beverage tax initiatives on this upcoming ballot. And then some specifics on what physicians and dentists can do. I actually got this directly from one of the advocacy organizations that's working on some of these renewal initiatives coming up. It's a group called inadvance.org, and I'm going to put their contact information in the chat here in just a second. But they are a group of community activists in Oakland working on something called the Sugar Freedom Project. And I asked for her wish list and what she wanted me to tell this group for getting involved related to these sugary beverage tax initiatives coming up. And so one, including with the timeline now between early spring, is getting involved with policy development. So helping to strengthen the policy language around the health impacts and defining impacted communities. There's an opportunity to get involved in legislative campaigns, sharing talking points and meetings with city council members, other decision makers, making public comments, writing letters of support. providing quotes for op-eds, and of course, perhaps engaging with the California Dental Association to do some of this work as well. And then with the ballot campaign, again, providing talking points, quotes for mailers, ads, billboards, et cetera, and even volunteering to go door to door and voter outreach. We have another group here at the University of California connecting all of the UCs together called the UC Healthy Beverage Consortium. And this is some of the advice that I asked for this group from the UC Healthy Beverage Consortium. And so some of their advice is to routinely encourage patients to vote in favor of these taxes in the various communities, to reach out and join community steering committees, or at least take a role in the campaigns leading up to the election by donating, taking house signs home, again, going door to door, maybe even wearing your white coat related to getting out the vote, and speaking up in the community related to these sugary beverage campaigns. And that's all I have. So let me drop the contact information for the Sugar Freedom Project and Molly in the chat. You can read about their organization, their website, and she even gave her phone number for anyone who wants to talk with her and get more information. And I will stop there and happy to take any questions or comments or feedback.
Hi, Dr. Kearns. Thank you so much for that presentation. My 2 years in the fellowship, I worked with Californians for Less Soda to help with some of these initiatives. And so this presentation was fascinating. I'm here to moderate any questions that the group has. You can just put them in the chat. If not, I have a couple questions that I was going to ask for you for our fellows. So one of the questions I have is, how can our fellows work with their local health departments to help advocate for some of this evidence-based messaging within their communities? So how can they get involved locally? You gave some examples in some of the charter cities, but how would they work on a local level?
Yeah, well, we actually have a really active state dental director, Jay Kumar, with the state oral health plan, who works with local health departments. And so they are, well aware, I think, of the dental caries issue and issues related to sugar, and implementing programs like Rethink Your Drink is one of the goals that Jay has supported through the state oral health programs. And so there definitely is knowledge in the local health departments related to these issues. And I am sure, they would love to connect with additional providers out in the community to help support some of those efforts. They may already have some materials created for these Rethink Your Drink campaigns that could be useful to relate to some of the sugary beverage taxes and other policies that may come up. The UC Healthy Beverage Consortium that I've mentioned has also put together some fact sheets related to sugary beverages specific to oral health. And I think there's been some collaboration with the state oral health plan and Jay and his department. So there should be, if there was an interest in reaching out and connecting, that would probably be a really wonderful community partnership to build on. And if the local health department is not focusing on sugar, some pressure from the community to do that would probably be welcome as well.
That's great. Thank you. We do have 2 comments in the chat. One is from Dr. Chan. She does want to connect with one of the UC consortiums. So it looks like she can just reach out to the contact information you put in the chat.
Yes. Yeah, that's for the advocacy group. I'll put my email. Let me put my email in the chat for the UC consortium. You can reach out to me. We will.
Perfect. And then Dr. Buell asked, what kind of participation do you need from the California Dental Association?
Yeah, well, the CDA has actually been really active in supporting sugary beverage taxes going back almost over a decade. I've had the opportunity to get to know Carrie Gordon at the CDA, and she comes and co-presents to our dental public health residents at UCSF. The last time we did that, which was just a few months ago, I asked her, what is the CDA up to on these most recent initiatives? And it didn't sound like they had quite gotten to the point where they were ready to ramp up to re-engage in these issues, though I know they're monitoring it. So I don't know exactly what they have in mind to do related to these all these initiatives coming up in November. I'm sure they've got something in the works, but I think any of you out there who are members of the CDA, reaching out to Carrie and others would be a great thing to do, and just sort of to check in on what's going on. I'm sure they would happy to have more folks to help them in some of the work that they're doing. I know that, and actually, what I'd love to do, maybe I'll follow up after this. There's a new article that just came out in the Journal of the California Dental Association. Jared Fine from Alameda County was one of the authors, and it tells the story of how he and others working with the CDA really supported the early sugary beverage taxes in California. So it's a great history of all the work that was done. So that's another great resource, and I can share that.
We followed up with asking, is there anything particular you would like the CDA to highlight? I'm thinking maybe you two could talk offline if Dr. Buell maybe is thinking of an article or something for the CDA.
Oh yeah, happy to do that. Just
Yeah.
reach out to me by email. Absolutely.
All right, that's great. And then I have another question for you, because I personally have taken the jump from a more clinical and administrative and then into this public health arena recently. You talked a lot about your journey and what made you do it, but can you be more specific of your career path of what you did? Because there might be some people in this audience who are thinking of making the same type of change, but I know how hard it is to go from the clinical world to the academic world. So you mentioned what started your interest, but how did you get to where you are now then?
Yeah. Yeah. So my career trajectory has been a little bit unusual. I had 1 year in private practice, and I really decided that that's not what I wanted to do. I didn't want to be so focused on trying to sell treatment and cosmetics. I felt like that was kind of the direction that my private practice was going. So I ended up taking a role as the dental director for Inner City Health Center in Denver. And that was a real eye-opener, seeing the burden of disease in my patients, in contrast to private practice. It was really just shocking. And, I was always trying to think about, well, realizing that me as one person, like I am never going to solve this problem. I had people with cavities in every tooth, and I might patch them up and send them back, and they might come back, with decay again. It just felt like a revolving door of endless disease. And ultimately, I ended up getting an MBA in health administration, thinking that, okay, maybe I can do something on a larger scale. Can we help make dental insurance more affordable for people? Can we help make dental care more affordable so more people can get treatment? And that's what led me to take the job at Kaiser Permanente. So it's the only place that Kaiser actually has dental under the same roof as medical, and they have 16 large dental offices up there. But I was on the operations side, but to me, that was about implementing quality improvement and operational efficiencies. Let's get our costs down and our quality up. And, Kaiser had an affordable dental insurance program. So to me, I was like, this is really great. I can get more care to more people. But then when I went to that conference and learned about what policies, what this guidance was saying at the federal level, I just was so shocked, and it made me really angry, because I felt like here I am doing all this work on the ground trying to improve health, yet at this higher level there's something that's undermining us, that it was just beyond imagination that we could have policies that weren't mentioning sugar related to diabetes, or that were actively promoting sugar as a healthy drink. And so that to me was the turning point. Like, I really wanted to do something at the policy level, and I wanted to understand what was going on behind the scenes with policy, who was influencing and how. And I never imagined that I would find sugar industry documents in a local library. You know, I hoped that I would, but I really didn't imagine that I would. And when I did, I knew already about the work that had been done on the tobacco industry at UCSF. And so I always had my eye on UCSF and wanted to somehow get my way here so that I could study with the tobacco control folks. And that happened, and that worked out. And so, you know, it's been just a journey I couldn't have imagined as a dental student, you know, becoming somebody that launches a food industry documents archive and connecting the sugar industry to undermining policy on sugar. So yeah, that's my story in a nutshell there.
That's amazing. And I think I read you also have your MBA and your PhD that you subsequently got, right?
I'm getting a PhD right now. And so, you know, all this work I've done collecting these documents and trying to write about them, I found myself wanting more. Like I didn't want to just be sort of a journalist reporting on these things that I found in the documents. I wanted to bring a sociological perspective to the work that I was doing, just to kind of understand like the role of these industry organizations out there in the world and the influence that they have and how they impact these policy discussions needs more attention. And so I'm right in the middle of a sociology PhD, trying to bring some social theory and theoretical grounding and learning some new methods to do the work that I'm doing. Yeah.
That's awesome. I think that's a path most of us would have never thought of, you know, and getting a PhD in that. I feel like us dentists kind of feel like you're tracked to do certain things. So this is really inspiring to hear that you can branch out of your traditional dental education and really make a difference on a bigger level. Does anyone else have any questions for the group? I see Dr. Chan just put in something in the comments, just have her on a different note, reach out to her if you're interested in writing an article with the CDA on sugars, food and beverage and caries. And Sherry's spouse is excited to try to pull clinicians into the public health world. Again, I know sometimes that's a challenge to make the jump. So we're all here to support you. And if there's no more questions in the chat, I am going to turn it back to Wagata for closing remarks. Thank you so much for joining us today.
Thank you, everyone. Thank you, Dr. White, for moderating, and thank you, Dr. Kearns, for a really wonderful talk. It's always really inspirational to hear you speak so passionately about these issues and talk about the systematic way in which you've approached it, and leaving us with inspiration. I think some of this can feel very much doubting, but you kind of ended us on a great note. And I'll also remind our fellows, many have been involved in their local Rethink Your Drink campaigns, which have been wonderful opportunities to advocate on these issues. And we also have a statewide campaign through CDPH coming out and partnered with Oral Health to also approach issues around SSB. So this has been really wonderful, and I think you'll have a lot of follow-up questions from many of the fellows and LHDs coming your way. And would just like to thank you again for your support of the fellowship, coming to speak, and to all of our fellows and listeners that joined us today from our LHDs as well. Thank you all.